TMD, temporomandibular dysfunction, jaw joint problems, and TMJ disease, if you want. A large portion of my practice is the treatment of that, and we do that with orthotics or splints before we ever get to orthodontics. I believe that if you're diagnosing properly, a large portion of what we see as maybe just braces is more than braces. We have eliminated, by the correct diagnosis and treatment, we have eliminated headaches in the vast majority of people who just think they need to suffer with headaches or who have been on medication for years and years and years. And in looking at that, it was very evident to me that there is a huge muscular component, and you need to be aware of that before you can be a superb orthodontist. That's my opinion. So you cannot isolate muscles from bone, from joint, from teeth. They all need to work together. And we come up with, for want of a better name, a physiodynamic system, or a PDS, that from the time you look at the health history to the time you do the clinical exam to what you see on x-rays and scans, all of those go together to decide how you are going to treat a patient. And you need to be very aware of the temporomandibular joint. I know that a good number of years ago, a group of some of the finest orthodontists around got together and came up with a paper, and their indication it actually was more than an indication. It said that occlusion and TMD problems were not related. A good part of my background is in physiology, anatomy, and neuromuscular dynamics. I studied that simultaneously when I went to dental school. And there isn't any doubt in my mind that they are absolutely related. And they are the reasons, one of the reasons why we don't finish cases appropriately, or why something that should take 18 or 20 months or 15 months winds up taking 27 or 30 months. It has to do with the misdiagnosis of patients and forgetting that muscles are part of it. This muscular component is not the typical component that we might see by putting a patient on a machine that gives a readout of what muscles are working. This is not like the Jankelson myomonitor. It is really much simpler than that. They can be recognized, and you can treat patients who will not only wind up with straight teeth and good function and great smiles, they will wind up really healthy and with no headaches. Of course, this doesn't involve every patient, but we've also come up with a number of things that I call it the diagnostic dozen, or 12 things that you should notice or be looking at when you diagnose patients, which will make things much simpler for the average orthodontist and knowing what he is actually going to treat versus what it looks like he or she is going to treat. Physiodynamics is I guess we made it up. I couldn't think of anything simpler. I would like to have a one-word short thing that explains what we do. But everything we do is related to physiology and anatomy. And it is a dynamic system. It's not just you put braces on and all of a sudden you're there. Teeth are moving, muscles are working, you have innervation. Physiology is either helping you or not helping you to get to the end product. And so this dynamic system, this human being that just doesn't sit there and not breathe for a year or 2 years, is always working. And you need to be aware of these. And I think we have, while the name seems a little complicated and a little bit clunky, as I might call it, I think it perfectly describes what we have in front of us from the time a person sits in the chair until the time we say we no longer need to see you. And it is a dynamic system. And I think we've simplified it so it doesn't get complicated so that you say, oh, I don't want to go through an anatomy course again. It's not that at all. It's just an awareness of what you need to see when the patient opens, closes, puts their teeth together, etc.